Hello, everyone. Welcome back to another episode of the Behind the Counter with NJSHP, a podcast that takes you outside the classroom and into the real world of pharmacy practice. My name is Sia Majumder, and I am one of the NJSHP Public Relations Project Chairs that works alongside Shiloh Dewan. In each episode, we talk with pharmacists from different clinical specialties to give you a closer look at what they do, how they got there, and what it's really like. In this episode, we provide an overview of pharmacy advocacy, starting with how the government functions and how pharmacy-related legislation becomes a law in New Jersey. We then explore into current issues in pharmacy, including provider status, pharmacy benefit manager reform, vaccine access and misconceptions, and how state and federal policies directly impact pharmacists and patient care. Through real-world examples and open discussion, we highlight why it's important for pharmacists to have a voice in healthcare policy and how students can begin advocating in the profession. Thank you for listening, and I hope you enjoy.
For today's episode, we have the pleasure of speaking with Dr. Daniel Abazia, a clinical associate professor and class of 2005 alumni here at the Ernest Merrill School of Pharmacy. Dr. Abazia did his PGY pharmacy practice residency at Albert Einstein Healthcare Network and specializes in medication safety, medication use policy, and medical information. He is also currently the director of the Council on Public Policy and Advocacy for NJSHP state chapter.
So, hello, Dr. Abazia. Thank you so much for being here today. Would you also like to introduce yourself?
Sure. Thanks. It's really a pleasure to speak with you today, and I'm looking forward to discussing what's going on in the policy world and advocacy world in pharmacy. I know it's sometimes seems abstract to students at the school, but it's really important to kind of understand your role and what you can do to advocate and kind of continue pushing the profession forward. But again, thanks for having me. I'm looking forward to it.
So, before we begin, I was hoping if you could give a short rundown of how the government works and the process of passing a bill, since a lot of our listeners are very new to this topic of pharmacy advocacy.
Sure. Yeah, and I'll try not to bore you all too much with you're possibly going back to any government AP classes maybe you took in high school or the like civics classes. It's similar to how a bill is passed in the federal government. For those that don't know or not New Jersey residents, we have a governor, we have two houses of the state legislature, all based in Trenton, New Jersey. And they work in tandem to put together or make laws out of bills that come forward. And so basically, what generally happens is that a legislator or someone that works for him or her on either the Senate side or Assembly side put together a bill, right? A document that they want to become law. And so I put together two houses of government that we have in the legislature. Their job is to write bills and for things to be enforced and regulations. And so there's the Senate and the Assembly. In New Jersey, all of us that live here are represented by one or two assembly men or women and a senator, somewhat similar to federal. And so both houses have the ability to start a bill, pharmacy or anything else. This is more general. One of them will introduce a bill. It then will go to the other house to review and make edits or get kicked out and say, no, we don't like this. And the process starts over again. Ideally, what happens is that the Senate and Assembly write a bill or something similar together. So you get sponsors on both houses of the state legislature. They come together, it goes to committee, and there's lots of committees, and it goes back and forth in terms of making edits. And so ideally, both sides come to an agreement eventually with a bill that then goes through House committees and gets a vote on both sides. If that vote passes, it goes to the governor's desk to sign into law, to get vetoed, meaning gets kicked out, and then it will kind of start the process over again. What I don't go over, there's a lot of in between during this process. The Senate might have edits, goes back to the Assembly, they don't like it, they have edits, and there's a lot of back and forth in committees before votes actually happen.
Thank you so much for that brief but very, very thorough overview. So, what's the difference between kind of what issues that can be kind of passed through legislation on the state level versus the federal level?
It's a good question. There's some overlap. For the state. How we practice pharmacy is governed at the state level, all 50 states. It's similar between different states. I'm licensed also in Pennsylvania, so I did my residency. I kept it. I was also licensed at one point in Illinois when I worked and lived there. The federal government is following the Constitution, is more focused on kind of protecting the homeland, as a lot of what we're hearing about in the news now, immigration and naturalization, national defense, overall bankruptcy laws, and things like that. When it comes to professional practice of professions like pharmacy, the federal government has basically kicked that down to the states. And so New Jersey is in charge of that. So New Jersey is more in charge of professional practice of pharmacists, medicine, nursing, education, more specific environmental laws. And so there is overlap. The federal law trumps the state law.
Is it any different for like a pharmacy related bill to become a law in New Jersey?
One thing I want to preface this, and I think it's something for all of us to be aware of, that healthcare in general, in the United States is the second most regulated type of professional practice. And when I say professional, or industry, I should say, in the country. And that's second to the nuclear power industry. And so we are very much governed by federal and state law. And so, again, when it comes to how we practice, how a pharmacist gets licensed, actually handles a prescription, gives a vaccine, handles documents, that's all governed at the state level. And so when it comes to, for instance, controlled substances, things along those lines, that's more a federal level. However, there's still a state drug control board that oversees that and has influence. And so when it comes to scheduled substances, Food and Drug and Cosmetic Act, like how drugs that are approved can or can't be used or transported across state lines. Once we're talking about things that happen going between New Jersey and another state, that's when federal law takes over. And when it comes to the practice of pharmacy, compounding requirements, while there is still federal oversight, it's more falls on the state government to the Board of Pharmacy and others to regulate.
Mhm. Yeah. I was wondering, just kind of cycling back to the
Yeah.
whole process of a bill passing. Like you said, there's like a lot of back and forth that happens with the passing of bills. And like, does how much of a delay that does that bouncing around? I know there are certain like some circumstances that may like accelerate the passing of
Mhm.
a bill. Like with the during the COVID pandemic, we had the bill that allowed the students to vaccinate.
Sure.
That was something that passed relatively quickly, I feel, compared to other bills.
I wouldn't say I'm an expert in that, but
Mhm.
it kind of depends on how much backing there is and even public support to the bill.
Mhm.
The one thing I've learned from legislatures and lobbyists is, hey, if it's something the public cares about or their constituents, their voters care about, they will act on it. And so to answer your question, it really kind of depends on who's involved and what it is. When it comes to pharmacy related laws, let's say one that NJSHP is in support of is what's called like white bagging legislation. So putting restrictions on PBMs, pharmacy benefit managers, in terms of telling patients where they can or how they can get a specialty product or ship it to them to then be given at a hospital instead of the hospital purchasing it and having safety checks and so on and so forth. There is a bill that's in the assembly now that's being looked at, but it's stalled for a variety of reasons. Number one is the pharmaceutical industry and PBMs don't want to be told what to do. So their lobbyists and others push back and get into the ears of people on the health committees that are looking at it. Part of it is other things happen in the state government. We just recently had a election for the governor and a number of their state assembly seats. PBM reform is important for everyone in the state of New Jersey and pharmacists, but our specific bill that's focused on white bagging, again, bringing a drug from outside of an institution into the hospital where we don't know where it comes from, we don't have the normal safety checks, in a lot of legislators' eyes is not as important. And so things just kind of stall there and just get put to the side, if that makes sense. So they could stay in committee for who knows how long, just
Right.
because. And then the legislative sessions change. Someone that was supporting this white bagging bill didn't get elected this past a few weeks ago. And so now we have to find other sponsors. And so it's like that cycle over and over again. It seems like you're probably thinking, oh, like, why would anyone want to do this? I mean, it's an interesting process, but it really does, it can be test your patience at times.
I see.
That's very interesting, but like also like concerning at the same time. Because like obviously like all of these patients like they're waiting
Hmm.
for their specific like needs, but like it's not prioritized.
Hmm.
Which advocacy issues are priorities for pharmacists currently? I um
Yeah. I'll focus on NJSHP because there is similarities. So one thing I'll take a step back is what I've really been heartened by doing this work over the past few months, and I've been involved with NJSHP since I was a student, and so it's been a long time. And for a while, we didn't always play nice with the other pharmacy organizations in the state for a variety of reasons. It's ego, power, money, all the things that we all love to fight about. But recently, I'd say within the last 5 years, especially after COVID, NJPHA, NJSHP, the Garden State Pharmacy Owners Association, so the independent owners have their own GSPO organization, have been having regular monthly meetings to talk about, with a lobbyist, to talk about things going on related to pharmacy practice or medication use in the state. And so we do align on a lot of things. What I care about in a hospital setting is different than an independent pharmacy owner. But for NJSHP, what we're focusing on in the coming year is PBM reform and transparency, going back to that white bagging restrictions. That's a big thing and really has hit the national news. And that's important for our patients and customers to know like why drugs cost a certain way, and because a lot of these are driving up costs. Promoting workforce development initiatives, so building and maintaining a good technician workforce. They were decimated through COVID. Maintaining and the fact that you two as students, making sure that schools of pharmacy and other training programs, residency programs, fellowships get support. Right now, there's always threats, at least I could speak for residencies, that the federal government has, and again, it's not related directly to the state, but it would affect us, is to claw money back because our PGY1 pharmacy residencies get what's called pass-through funding from the government. So if we have a residency program, we basically get paid back almost in full what we pay those residents to have them. It's to build training programs and things like that. That's a threat. Again, not focused solely on the state, but that's something that we work on. But even more so with technician initiatives, techs can elevate to a certain part and then oftentimes burn out, look for higher paying jobs. And so we're trying to create better pathways for techs to do more advanced work, like in transitions of care, informatics, 340B management, things like that. 340B, another big supporting protection. And I'm not sure if you guys are aware of it, but it's federal law that allows, not so much, it's part of a law that carves out special pricing, like the lowest pricing available to the federal government for hospitals and health systems that serve a certain number of disproportionate share of patients, or they have a disproportionate share of low-paying, non-insured patients. And so that's been huge to provide services to patients, get drugs at lower cost, especially specialty and higher cost items. But I don't want this to sound anti-pharma, because I've worked with pharma in the past. They're important players, but they obviously don't like it because it may cut into some profits. And also there's some institutions have taken advantage of the low-cost drugs, high reimbursement, and are they putting that back into care versus just expanding a new pavilion? I'm not saying that's done everywhere and that's rare, but that's a concern. But for us and NJSHP, the concern is if 340B were to go away or significantly change, the amount of expansion that we've been able to do within just getting pharmacy access to patients, providing more advanced clinical service, especially on oncology, specialty drugs, would go away because it would be hard to pay for it anymore. The federal government has been maybe piloting with some companies and certain drugs a rebate program. I don't know if you guys have heard of this, but for now, when we if we're 340B eligible, and the system I work in, many hospitals are, not all of them are, we get discount pricing right away. What they want to pilot is a rebate program where we have to pay full price for the drug or the contract price, and then have to submit for a rebate to get that money back. And I don't know about you guys, getting close to the holidays, what would you rather do if you're buying something for Christmas? Would you rather just pay up, like get the discount up front, or would you rather pay full and then have to submit for a rebate and hope that you get the money back?
Definitely just pay up front.
Right. So that's part of
Mhm.
it. But the risk is 340B has allowed us to expand and especially
Mhm.
areas where we have lower income patients.
Mhm.
Last two things are somewhat interrelated. Um, Expanding scope of practice for pharmacists and techs. One big thing is expanding the ability for pharmacists to prescribe, as an example, and also provider status. Provider status is really being recognized by the federal government as a healthcare provider so that we can bill Medicare and Medicaid freely for services. So it's kind of a chicken and the egg for both of those. But those are our priority. There's a lot. We're probably going to focus on some, but those are the main ones that we're going to be looking at.
When I was applying for colleges way back, I saw pharmacy on kind of the same level as a doctor.
Mhm.
But as I'm going through my schooling at this Rutgers School of Pharmacy, and also just like um, seeing what's going on with pharmacy advocacy, I'm starting to learn more and more that pharmacists and doctors are not on the same playing field at all. The amount of training you receive for certain things is you don't receive the same benefits as those as doctors who also receive the same kind of training for some certain tasks. Why don't pharmacists have that same kind of provider status as doctors, even though we may provide similar services? Like, what's kind of stopping us?
It is how we are regulated by the Board of Pharmacy
Mm.
and within the state. Part of it is pushback from physician groups and other, let's say, what are called and mid-level practitioners, which is maybe not the best term, like advanced practice nurses, physician associates, now they're called, not physician assistants, who have prescribing privileges, who kind of are like, wait a second, this is our deal. You guys want to prescribe too? That's our job. You dispense, you review. And also within our own, the biggest thing is within our own profession, that there is not a sole cohesive voice to say, hey, we want this. We want to be recognized as providers, even though in our heads we are, and we do a lot of work, especially out in the community, but to be recognized by the government to bill Medicare and Medicaid services. Um, so that's the main reason why now within New Jersey, we're not considered providers, quote unquote. There are certain commercial plans or Medicaid, I should say more so in New Jersey, Medicaid, which is the state-run health insurance program that um, may allow pharmacists to bill for services. If Shiloh or you guys are in a clinic and you are working with patients that have insurance or Medicaid, there's nothing to say you can't submit a bill for those services to Medicaid or even a commercial provider, really. But they're not obligated to pay you. That is
Oh,
up to them if they have that policy and procedure in place.
interesting.
So there's that. There's not that mandate. So we're kind of like, well, we hope we get paid. The argument for provider status is, well, we do a lot of work besides dispensing. And we're not necessarily looking for yes, we're looking for a slice of the pie, but for the work that is done, it could expand and improve outcomes. And there's plenty of data to show pharmacists and especially ambulatory settings can do a lot of good and be physician extenders, if you will, and really help them expand. And then even more so as we run up to physicians a shortage, well, why can't we also step up and provide some of that more primary care and more medication therapy management services?
Like I said, like seems like the biggest issue is that there's just issue in unifying on this idea of kind of
Mhm.
advancing our provider status. Does that issue come from like a generational gap? So I'm just wondering, like, is it like pushback from like maybe older generations or even like from the younger generations where they just don't see eye to eye and feel like they're comfortable where they are now and kind of scared to advance? Is that
Uh,
kind of
yeah,
happening?
I think all of those really. I think that's the tough part. There's not one main reason. I think there is
Mhm.
somewhat of a generational divide.
Um,
And I've seen it too. I've been now doing this for 20 years, which is
mhm.
crazy to me. But even then, I feel like we're still talking about things that I was hearing when I was in your seats,
Mhm.
in terms of advancing practice. At the time, it was Pharmaceutical care was the term that we used, not so much comprehensive clinical services or medication therapy management, things like that. And to some extent, we're good. Pharmacy is very good at repackaging the same idea as a new word, a new phrase. So yeah, it's somewhat generational. There is some sense of complacency. Things are going okay. Part of it is also what is if we are a gatekeeper to safety. So if we all of a sudden pull away from that and are prescribing and dispensing, does that hurt the patient overall? Part of it is there's still a lot of pharmacists who don't have advanced clinical training to do this. And so there's a hesitancy to allow that because while pharmacy does have a standard amongst the 50 states licensing process, right? We all take a national exam. Now most states offer the law exam. But physicians really to practice, they have to go through undergraduate training. Pharmacists don't, right? I chose to do a residency. You can then do a second year. You could do fellowship, but that's focusing more on research or industry. So there's that disconnect as well. That makes it tougher. And then the other piece is in hospitals, you don't need to be considered a provider to provide advanced services. When I was a student, I didn't know much about it until I learned. I was like, oh, cool. Like pharmacists work in hospitals. They can go up on the floors. They could dose and manage medications and yeah, some ideally we'd have more specific agreements, but hospitals allow pharmacists to do that. In the community, it's harder to do that. And so some community pharmacists don't feel prepared, don't have the time. So it's multifactorial.
Mm-hmm. So I understand that like there's that generational gap and then also I guess like lack of knowledge on the issue that's probably like stopping like pharmacists from like speaking up on the issue. But are there like any ways that we could bring this issue into light coming from like a pharmacist perspective or like a pharmacy student perspective and like talking about it?
Well, yeah, I mean, so let's look at where far in since I was in school, where we've seen a lot of advancement. It may not seem like it to you guys, but for me, I've seen it is within immunizations. From when I was a student, we learned how to do immunizations, and it was some pharmacists did it, but it was rare to do that. To now, my daughter, who's almost 7, when she thinks of the pharmacy, she gets a little freaked out. She's like, oh, am I going there to get a shot? Because as much as she gets it from her pediatrician, COVID vaccines and others, like she sees the pharmacy as a place to get vaccines, which is kind of cool. So how to do it, it really is, what I'm learning is what do people care about? Do my mom and dad care that their son is allowed to prescribe medications versus going to a doctor or nurse practitioner that they trust? Does it really impact them? Maybe. I mean, they might, but if the general public feels and is like, wow, we really would like pharmacists to immunize because it's much harder to get appointments with my doctor. I want to be able to get a flu shot when I want it. So it's that convenience. I think we need to answer your question, we need to sell besides what's good for us and maybe, okay, making some money off of it. I'm sounding very crass, and I know that's not generally what we think about. What does it do to help people? I know that sounds silly, but you ask most people, they don't want to see their local pharmacies or chains go away. We've seen a ton of pharmacies close. There's a number of clinics. There's pharmacies around that do some pretty interesting point of care testing and other more primary care. I think the biggest thing for students, for us, is we talk a lot about like our own language of what we understand, but provider status, payment parity, things that, okay, I understand, but most people outside of this profession don't know about or don't really care. But if they know, again, that they can get even beyond vaccines, but can get oral contraception or certain tests that they need for a job without waiting and getting an appointment or needing a script and then needing a referral, that's huge. And I kind of go back to immunizations as being one of the key things. Again, I hear, if you guys hear about immunization commercials, there's controversy because of the current administration, but beyond that, when I hear them, no longer is it just go to your talk to your doctor about it's now talk to your doctor or pharmacist or just like I never heard that 20 years ago. And so to wrap up this, I think it really is tying into the public health aspect for us and for you all as students to advocate. Again, and same when we talk to legislators, they don't care really about how it affects me. How does it affect their voters?
In my elective class, we learned about how important pharmacists are in the sense that we people visit the pharmacy more than they visit their doctor. But at the same time, it feels like we're still we're viewed as kind of not less important, but we're not viewed as high regard as doctors, even though or they don't view us as critical to compared to doctors, even though they
Mm,
visit the pharmacists so much more. And then, like I said, pharmacies close. That impact is felt like very strongly, especially with like Rite Aid closing and
yeah,
other possibly CVS or some other big chains closing soon because these creation of pharmacies deserts, that's something huge. And
sure.
so I like I said, it's just I feel like it's so important just for us as students and as healthcare professionals to make our presence known because even though physically our presence is there as a society, I don't think our presence is as like pronounced as it should be, I feel like. But
Yeah, I would agree. And I think that's sometimes it's how the profession has back when pharmacists and physicians were the same. You had the apothecary, but basically like they were treating people with whatever concoctions that they made. And then eventually during that time, the physicians branched off to do more diagnostics and treatment, and then the pharmacists kind of just were the compounders. And so I think it still goes beyond yes, we are patient focused, but we still like what we do and what we learn about our products. And so it's a matter of, to me, this is my opinion. I think we just have to own being the expert in drugs. And yes, it is a product. And I think we have to do a better job of explaining it. It's not just some commodity that we just take, and there's a lot more to it. Um, but because of that, we get lumped into pharmacist sounds like pharmaceutical company and doesn't always get the connotation. I think a lot of people, if you ask them, they either are ambivalent about a pharmacist or have generally a positive opinion. But it's also on us as a profession. Again, we have health system pharmacists, we have clinical pharmacists, we have community pharmacists, we have managed care. And so, again, most people don't care. I never, I really, when I introduce myself now, especially as I get older in my career, I'm a pharmacist, but I'm a faculty member at a school of pharmacy. I try not to go on clinical, and because I just think it confuses people. So language is important. I think that's really what we're now, as we advance and try to get provider status, or we try to increase our scope of practice of what a pharmacist can do. Language matters. If there's any takeaway from our discussion is using that language is helpful in talking and knowing our audience.
yeah, I guess another kind of related to this idea of language, the language surrounding like not just pharmacists, but healthcare professionals overall. In this current administration, it's been very shaky in some ways. My question is just like from a personal standpoint, as pharmacy students and kind of people aspiring to be pharmacists, how do we kind of navigate through this time where we're not under, I wouldn't say we're under attack, but it just feels like things are uncertain for
Hmm.
us in some ways, especially because recently a bill was passed recently where nursing was declared as a non-professional
Hmm.
degree, which was something I couldn't believe. But seeing that trend in this kind of circumstance from now is kind of scary. So,
Sure.
how do we, as pharmacy students or as pharmacists, how do we kind of navigate through this time?
It's an excellent point, and I was just reading something about the federal government in terms of, I think, reimbursement for or financial aid coverage for health professions. And I don't quote me on what it's called or so, but they removed a number of professions from the list, and so then capping the amount of money that a student can get. So it really affects the students in these programs, nursing's included, PA. Fortunately, pharmacists aren't considered professionals, and all of you in programs won't have limited amounts of money that you can use for schooling. But so I think since COVID, that pandemic, and when it started in the first few months as heroes and then like ended and even to now, there's as not heroes. I wouldn't say they're evildoers, but some people think that. I think trust was lost because, again, muddied messages about vaccines, about masking, and so people like us that are considered trusted no longer could be because they're just mixed messages, and different parts of the country were affected differently. So fast forward to now where that we're kind of under attack, and especially and depending related certain therapeutics especially are targeted, like vaccines and contraception and whatnot else that are generally more controversial in general. A lot of it is part of it is also because there's so much more information available to us, and artificial intelligence allowing so much easier to get an answer or something crafted for us has now made the amount of information being poured at any given person, pharmacist or not, is untenable. You guys probably get tons of it. I know we through the school send it to you, and there's just constant amounts. Social media doesn't help. To answer your question, what can you do and how to stay on top of it is kind of what we're doing now, is not putting your head in the sand. There's been too many healthcare professionals, including pharmacists, who will actively not want to engage or even listen or participate in these types of discussions. And when I say participate, I'm not saying you have to be like me and join a council and lead it and do all that stuff, because it's great if you do, but really of just like paying attention to what's going on, voting for something, or sharing an opinion to an organization or to a legislature or your school of pharmacy, whoever, your town, whatever it may be, your employer, if they have the ability to do it safely without you getting reprimanded. And I get it. I'm a father. I have other responsibilities, and it's very easy for me to be like, I'm still getting a paycheck. I'm still practicing okay. But really what it does when we're that lackadaisical, it then hurts you guys that are coming up into the profession. Because as much as we're highly regulated, it doesn't mean things can't change. And there are people who do have certain ideologies that want to change or make it easier for anyone who doesn't have a pharmacy license to be able to do things that we do without the proper training. And so really there's no answer, but I think part of it is engagement and advocacy. And advocacy, really what that means is education. It doesn't mean you have to organize a group to march down College Ave about something. It's educating folks. And that's just part of our normal job, if that makes sense. It's when it comes to, let's say, again, I'm going back to vaccines because that's a big topic, is if people do bring up something is crazy, it's a matter of just listening to them, acknowledging them, but also then advocating for what we do and what we know. May not change your opinion, but at least you're getting someone to think about it, if that makes sense. The biggest piece is ambivalence. That's hurt us quite a bit, and allowing others to dictate the narrative. That's what, like, I'll end with this. What aggravates me is when some medication related topic, and instead of talking to a pharmacist, it doesn't have to be me or anyone with special knowledge, they're talking to a journalist. Not to say that they're not knowledgeable, or they're talking to some non-person related to it for whatever reason. And so we're kind of shut out. So it's a matter of like stepping up and taking ownership of it.
Yeah. Yeah, I guess it really shows like how important being educated about advocacy is. Because I just think the main problem is just how we're very aware of these topics. Because even like as a PP2, I'm focused on like taking Orgo and like all
Sure.
my classes. And we've never got the opportunity to talk about this stuff. Like this is my first time for me to like talk about this
Yeah.
topic of pharmacy advocacy. So yeah, it's just like bringing this like issue to light, and then making sure we're all getting like this is being talked about in classes and especially like in school. Yeah.
Yeah, no, that's the biggest thing is talking about it. And like I said, advocacy is issue education. Lobbying is when you're focusing on a specific bill. We're not talking about even lobbying. It's just advocacy for what we do and what's for the patients. So yeah, no, it's a great insight. And I'm hoping the one thing I'll say is that the standards, the 2025 ACPE standards, the American College of Pharmacy Education, that governs what you guys learn, has now a specific goal of advocacy. Whether or not it's because of we haven't been doing a good job, but that's a big portion that we all within the school, not every class, but really have to make a concerted effort to include advocacy in your training.
Mm-hmm. Moving on to our next topic. I know we touched on like federal issues, so and also this one about PBMs.
Mm-hmm.
So just for listeners who may not know, what exactly is a PBM and like what do they do?
Sure. A PBM stands for Pharmacy Benefit Manager, and they're basically manage the medication prescription drug coverage benefit for an insurer, right? They didn't exist for a number of, a few decades ago because insurers had prescription plans that they managed, became more cumbersome. So these developed and often are owned and operated by health insurers. And so their job is to, provide payment processing for prescription coverage, manage what drugs are covered and are not for their members. And so they've been controversial because as much as pharmaceutical companies set prices, as a middleman, they also are setting prices for drugs for their patients or what gets reimbursed and how much and also are very, again, control the formulary and what can or can't be used in certain populations. And so they really do play an important role, especially in, outpatient medication management.
Yeah. I remember, I think this was a while ago. I remember reading something where like at Congress, I believe someone presented this fact about how I forgot what medication, but it's like it took like $1 to make the medication, and then it was priced at $1,200 or some insane price. And I remember that was my first time getting exposed to kind of how insane, or not insane, but how crazy things are when it
Hmm.
comes to PBM sometimes. And all I could think was like, wow, how has nothing been done about this yet? Right. But now that it's feel like it's become such a big issue and it's coming to light, not just for us as healthcare professionals, but also amongst, like you said, like outpatient settings and people who pick up their prescriptions, they're starting to realize how big these PBMs are and how
Hmm.
important it is to kind of change things to better not just the patients, but also not just the pharmacist, but also the patient too.
Right.
And so I guess just focusing more on the pharmacy side and things, what do you think is kind of the biggest issue facing pharmacies across not just clinical, but like including community pharmacy? What's like the biggest issue that pharmacists currently face against PBMs, and what's currently being done about it?
Sure. I mean, I think the biggest issue with PBMs, right, is at least from a pharmacy perspective, is just the reimbursement rates that they are provided that are not necessarily keeping up with inflation, with drug costs. Because again, they're managing that, right? And both from the patient side, in terms of copays and whatnot else, and if you were to look at some map, I had something, it's probably more complicated now, the sheer number of different arrows of where, from the patient to the pharmacy to the PBM, back to the, insurer, back to the PBM, to the manufacturer and rebates. And um, the biggest thing is for pharmacy and pharmacists is just, again, the sheer power that they have in terms of either two things, dictating, right, how much you're going to get reimbursed. And many pharmacies can't stay in business because they're losing money, right, on a number of drugs. And then when it comes to health systems, again, we go back to the white bagging piece. And when I say white bagging, because typically, let's say a specialty injectable is sent from the PBM specialty pharmacy directly to the patient, and they're told, bring it to your outpatient clinic that's owned by, Hospital X and get it administered. Well, Hospital X doesn't want to do that because that's not our drug. Yes, we will lose. We're not able to then charge for that drug. And again, it's no one really wants to hear about this, right? No patients do. They just want to get their medication. But it could delay therapy because then we haven't purchased it. Is it the right drug? It's not built into our computer system. And so when you're restricting where and how patients get drugs, it doesn't help, it doesn't improve care, right? There's also with brown bagging, people bringing their own medications, right, into the hospital, and then clear bagging, which is what, we like, which is our own drugs in a hospital setting being administered, at the point of care.
Again, going back to my elective, one of the projects we had to do was actually writing a letter to a legislator about a bill related to pharmacy. And the one I wrote about was, oh, I'm drawing a blank, but it was basically how PBMs, they have the power to, like you said, kind of move patients from picking up the medication from X pharmacy and making them pick it up from somewhere else.
Right.
And when I read about that, I was like, that's really scary because for like you said, from the pharmacist perspective, they're losing money on that. And but then at the same time, it's such an inconvenience for the patients
Sure.
in that they have to
Yeah.
go from some pharmacy they may have never been there before because the PBM, the way they regulate stuff, they're making that patient go to another pharmacy to pick up the medication.
Right, and that's why it's now, legislators, and the, state and federal government are more aware of it. Number one, because their own constituents are complaining about it, but it's
Mhm.
because they're complaining about it. It's getting more expensive for them, right? And we're already hearing about, right, premiums for insurance programs are going up, so healthcare costs, right, including drugs. And again, it's restricting access. And so, it frustrates people. I've been there too, when you can't either go to the pharmacy that you want to go to or get, the chemotherapy that you need at your doctor's location, if that's, the case. So.
Yeah, so moving on to our next topic, we did want to touch about vaccines. I know we kind of talked about
Mhm.
that before. Um, so I guess like a lot of people like we wanted to focus on like the misconceptions of
Mm.
vaccines and like how does that impact a pharmacist's role and in administering these vaccines.
Yeah, I mean, they're, the misconceptions are all over the place. Big ones being, they're, have some mind virus in them or some sort of chip in them to control us. They're not, not even a misconception, it is a misconception, but that vaccines, why should I get one? They don't actually prevent you from getting an illness. Well, that's maybe a part of when I say ours, healthcare providers, we haven't done a good job communicating that vaccines are not, 100% cure or prevention, right? They can in many cases, but if anything, they're going to make you less sick if you get a certain vaccine. And then the other piece, the big one, it's just hit within the last week, vaccines causing certain types of disorders like autism, right? Unfortunately, and I say this with all, respect for the CDC, but also we all, with what they've put up there now that they're saying they don't, the evidence does not exist to say that vaccines don't cause autism, which is a huge um, change in what we've seen, which is there is evidence that vaccines don't cause autism. So now it makes people more concerned and is somewhat of misinformation about getting vaccines, especially for children, if that makes sense. So, we basically said we have evidence that they don't, which I agree. There's not been consistent evidence. Now we're kind of changing what science is, right? Science is you have to prove something, right? Correct. Now we're doing the opposite, which is prove me wrong, which is not science. So that's, I think, the biggest piece. And so, for us as pharmacists is to again, listen to people. There might be people who have strong opinions, and it might seem absolutely ridiculous to you when you talk to them. Could be maybe when if you guys are celebrating Thanksgiving with family and friends, maybe you'll have crazy, family members or friends who say things. It's very easy to like get angry, but just listen and then, as best we can counter, not like to be all high and mighty and say this is what we know, but just to say, well, that's not true. This is why. And you might not convince them. But I think, again, again, the pharmacy profession of getting out in front, have kind of taken a back seat to let other people dictate.
Yeah. I think I like talked about this before, but like over the summer I had to do like a tabling thing for CVS because I'm just like a tech there and like it was just like telling people to get their vaccine when the new flu shot and COVID shot came out. And oh my God, that experience was definitely like a first. Like so
Sure.
many people like obviously I got some people to get their vaccine, but so many people were just so strong in their opinion of like how they aren't helpful and just like their misconceptions and just like
Right.
bringing it to me. And I feel like I wasn't prepared for that, like to
Hmm.
like address these like misconceptions. Like my job was just to like tell them to go in the back and like get their flu shot, but like
Right.
there were so many
Yeah.
people that came with their strong opinions and just like super upset that over the fact that I was even asking them to like get a flu shot
Yeah.
or like vaccine. So it's just like very like scary to see that. Um, so I know like just like bringing up at like a at the table like talking about it Thanksgiving like helps a lot. I also thought it was like interesting like how it's like us pharmacists aren't talking about it. It's more like you were saying like journalists or other
Right.
like politicians that more have a bigger or like just
Yeah.
are the
Bigger
ones that are
platform.
talking about
Yeah.
it.
Exactly.
Yeah,
Yeah.
even though they're not the ones administrating
Hmm.
it or know about it. So, yeah.
Yeah, that's again, that's my own pet peeve, right? And I've been fortunate in my role here. And listen, you don't see me on the news, so it's not like I'm making that big of a splash. But there we do have journalists and others that do reach out pretty frequently to the School of Pharmacy, and depending what the topic is, I've done it a few times, whether it's a short interview or a little blurb on something. Not necessarily one. I did do something on flu vaccine, but it was more generic. But yeah, making sure that we're out there sharing that info, and it's tough, right? And
Mhm.
I've had where people are almost yelling at you about why they're not going to get a vaccine. They don't want like to be told what to do. It's their body, their choice. Understood, right? And it's hard to then argue with someone about public health, versus their own private choices. But what I'm learning is just kind of acknowledge I hear you, right? Doesn't mean we can, have to agree, but then let's start about something. Let's get to a point where we can at least hear each other out, right? And so I know it sounds very, you know, lovey-dovey, but in a way we kind of all have to do that, or if not, we're just talking past each other.
Right. I was thinking kind of this idea of language in the sense that, at least for me, I haven't had the experience of kind of talking to people who are skeptical about vaccines yet, which I feel kind of lucky about it, but also kind of sad about it because I feel like that is a good experience for people to have in the sense that it gives you an experience to understand how to kind of meet these people eye to eye, right?
Hmm.
But I guess my like biggest question is when it comes to talking to people about vaccines, how do we kind of not limit our language, but change our language in a way to help them understand it, help understand the importance of being vaccinated without
Mm.
making ourselves seem too egotistical. Like,
Yeah, no,
yeah.
it's a good question, and I don't. Unfortunately, it makes the job more difficult, right? Is communicating and how to get through. I think what I've found is besides just like, oh, the public benefit, and a lot of people are individualistic, so I think you just have to bring it down to their like to them individually,
Mhm.
right? Why it's important. So if it's, let's say, someone who's really anti-vaccine for whatever reason because they just don't like the government telling them what to do, so on and so forth. I think part of it, sometimes it takes a couple conversations, if you even have that, right? A lot of times we don't. People come in and out. Is, learning a little bit about them, right? What they do for work. Do they have a family? Kind of making it more about them, as much as, yes, it helps everyone else. If they're really worried about a job and saying, hey, you're right, like for the COVID vaccine, right? A lot of people are like, well, I still got COVID, so why should I get this thing? Okay, you're right. We were wrong. We should never, healthcare, federal government should never have said, get this vaccine, you're not going to get COVID, you're not going to spread it, right? That's not how, I think we just acknowledge that. That's correct. However, if you do get it again, you're going to be much less likely to get sick and you can still go to work, right? Or you could still make your kids' soccer game. I don't know. It's hard because you need to learn a little bit about people. But the big thing, I feel like I'm saying the same thing over again, so I apologize, is meeting them where they're at and but also acknowledging what they say, right? If they say, well, I don't want my kid to get the MMR vaccine because I'm worried it's going to give them autism. And you could say, okay, I understand, right? And I understand that concern, and right, there are risks to vaccines, but right, that as much as the federal government is claiming that we don't know enough yet about them, there is enough information if you look at it, like that it doesn't cause it. And yes, some kids do get it, but there's better diagnosis, right? There's
Mhm.
a number of other things that unfortunately may be in the environment that's causing it. Like you can get it's a tricky line because then you don't want to go down the rabbit hole of everything else. And
Right.
right, Shiloh may not have time if you're in a busy pharmacy to have, a 20-minute conversation with someone. So if that, that's I think a lot of it's really bringing back to the individual, right? How does it benefit them? We're just acknowledging, yeah, you're right. We were wrong about some of these COVID things. And we haven't done a good enough job of just doing that. And then starting the conversation. Because sometimes people just need to feel heard, right? No one's listening to them.
So I know like tariffs have been also playing a role like recently with politics. So like how does tariffs like add to this issue of vaccines?
Um, Honestly, not not too much. I mean, there's because right, it's even hard to tell where the tariffs fit with vaccines and other drugs because you'll hear that drugs are being, there's tariffs on things that are manufactured outside the US, and a lot of vaccines are. Not all, but a lot are.
Right.
That doesn't seem to be the big issue right now. It really is just public perception. Unfortunately, now federal government communications about vaccines. So that's been the biggest piece.
Hmm.
Then I guess staying related to the idea of tariffs, because for me, when I read about those tariffs, I thought that the price of drugs, not just like I was moving away from vaccines, like the price of drugs would go up a
Mhm.
lot. But is are tariffs really like a big issue right now for pharmacies, or is that something that isn't that big of a
It's a good
problem?
question, and I'm not in a role. Well, I mean, I'm aware of pricing and what I do, but I'm not in a role where I'm looking at it day to day and making purchases or approving, purchase orders. It is an issue in that it's somewhat of an issue because it's well, like for instance, like 10% tariffs have been levied on everything else. I think a number of manufacturers and wholesalers are absorbing a lot of those costs. So there hasn't been any significant increase, mostly because also the administration has not necessarily applied all those to drugs. But again, I'm not exactly sure. So I'm saying this out of what I have read or about. The bigger issue with tariffs, the worry is that they, if it's becoming not um, financially viable for especially generic companies to create these and then get tariffed and then bring it back to the consumer, they might stop producing drug, which then leads to shortages, right? And so drug shortages have been a pretty major issue since I have graduated, especially in the last 15 years, let's say. I didn't, it's like remember when I was living and working in Chicago. It was really in like 2010 that I remember really hearing more and having to deal with shortages more commonly. But that's the biggest thing that tariffs can have an impact, just of like impacting the supply chain that then affects us, which also then can increase costs or push buyers and pharmacies to then in a hospital pharmacy to look for gray market drugs, right, where we don't know exactly the pedigree and where they're coming from, which is can be dangerous.
So I want to talk about like the lack of progression in the pharmacy practice. I know we touched about it before and like um we definitely have seen progression and when you said like the vaccine example like
Mhm.
oh when your um child like went to the pharmacy like she sees that as somewhere to get a shot and I thought that was very interesting and like
Right.
seeing that change over the years. Um, but how does the lack of progression affect pharmacists' day-to-day ability to care for
Mm.
patients? Yeah.
Yeah, I think going back to our earlier conversation, healthcare is so fragmented now, even more so than it has been. And it's unfortunately it's not. One of my P4 students that's with me kind of was asking me the other day, like, what is my thought on healthcare? Like, how is it really as bad as it seems? And it's not ever as bad as it seems, but it's become more fragmented. And I think the lack of progression in what a pharmacist can do. And again, it has progressed. I will say, like, there's a lot more faculty that you guys have or will have teaching you that are in really unique practice areas,
Right.
right? In ambulatory environments specifically, like inpatient as well, but especially in areas where we're directly, and providing more of that direct patient care. So that's a good thing. So we have advanced. But still, when it comes back to scope of practice and having a collaborative practice agreement with a physician or a whole group of physicians to do test to treat, to prescribe certain products. It is done, right? It is done in certain aspects of our faculty and other pharmacists. A lot of times, though, it's cash pay. It's not because we can't get reimbursed from an insurer. Um, Not being able to do a lot of those things as much as other states, doesn't help our patients, right? Get care and some of the quality measures that we measure. Again, I think we went over it, but the obstacles are multifactorial, right? It's
Yeah.
us as a profession, it's training, it's pushback from other providers, it's lack of a coherent message to legislators. So it impacts. It's not necessarily helping people's care, right? Yeah, we're still getting them medications when they need to, but 20 years later, we're still not, I'm not seeing, when I pick up a prescription for my son, I get even less attention, I feel, right? By the pharmacist, if that makes sense, right? I'm not saying that to then aggravate anyone who's listening here, but right, we were sold like, oh, you're going to have, how much time to get a counseling from every pharmacist? Well, we found workarounds. And so until we either, are allowed to do that, but also advocate for better work conditions, right? And allow more for technicians to do more day-to-day operational tasks. That's huge too. And so we've made some strides, but we're still not fully there yet. Technology is supposed to help, we shall see.
Yeah. We're, I don't know if we should talk about, I'm just curious, but
Mhm.
when it comes to technology, a lot of like, or when I talk to some family friends about kind of the uprising of AI and stuff like that,
Mhm.
there's they they talk to me and say like, aren't you scared of AI replacing your job?
Mm.
And I guess just kind of like as like a message to all of our listeners, do you think that AI is a threat to pharmacy, and should there be like legislative focus
Um,
on that at all, if
yeah,
any?
is it a threat? It is a threat, I think, to certain types of roles and positions.
Mhm.
If it's a pharmacist position that's purely dispensing, right, in terms of reviewing a product, or reviewing an order, prescription, approving it, right, if it's an e-script,
Mhm.
slapping a label on it, all those things, checking it. Yeah, that's a risk. And checking for drug interactions because the technology when it comes to machine learning and generative AI is advanced. Again, we all know it's advancing quickly, but it's at a point where yeah, it's only really what's protecting pharmacists is the fact that we have state board of pharmacy rules and regs that require a pharmacist, right, to do these things. We're not, at some point that might change and, where you don't need the ratios that you need can be increased. And so you don't need as many people. I think when it comes to pharmacy, right, if we're learning how to use it in a clinical setting, um, it will be advantageous, which is why I'm interested in it, which is why I like to teach it at the school because I think it's here. We need to learn how to harness it, but it will certainly replace some very basic roles when you're not using like your knowledge to then put together, kind of apply it to a specific patient or population, if that makes sense. When it's purely checking for drug interactions, lab values, we're at a point where AI can do that very well, right? You don't need a pharmacist. And we already have, there's in many emergency departments, depending on the electronic health record we're using, they have, technology where an order isn't initially reviewed by a pharmacist and gets approved. For urgent settings, theoretically, we're supposed to review it in the back end, but still, right? That technology already exists. I don't think we're far away. And I was saying that honestly, Shiloh, what is it now? 2025. 10 years ago, I remember when I was with other students, and AI was starting to pop up within certain pharmacy areas. And I was like, guys, like be careful, right? When certain pharmacy students would hem and haw about, oh, I don't need to know this or whatever. Why do I need to know how to look this up? Or why do I, it's like, well, we're not far away from technology that's going to replace some of these basic functions. So even more so now.
Very, very true.
So we did get a couple questions from our survey from
Yeah.
students. So I'm gonna ask this one. Uh, is pharmacy advocacy a career path or something that pharmacists or other professionals involved do outside their main jobs, or
Hmm.
is it something they can integrate with their actual
It's a
career?
very good question. It can be a career path. There is the ASHP, APHA, most of the major organizations, I know those two explicitly, have postgraduate fellowship programs in advocacy and public policy, right? Where you would go to their offices or go into Washington to learn and work with legislators, maybe, certain executive branch area to learn the health policy and pharmacy advocacy. I'm drawing a blank on his name, so I apologize. I should have been more prepared for it. But there is a
Good.
Rutgers graduate, pharmacy graduate from a few years ago, who is a health policy um, aide within the Capitol Hill, and he works for a specific senator, I believe. Um, but he is, he's spoken. You guys may have seen him before. Spoken at Rutgers a few times. A really good guy, but he's made a career out of. He was a fellow, I think, with the ASHP or APHA, and has stayed on Capitol Hill since, and really, is works directly with people creating laws to influence health policy. And so it can be, it can be if you are interested in law, you can kind of go along law school and go in that route. It certainly can be a career path. For me, it is not, but who knows? Who knows what we'll turn into. I'm getting more interested in it as I do this volunteer role, if you will. So.
Nice. I guess just to conclude this whole episode, what does advocacy actually look like for pharmacists, and what can us as students or just as individuals, what can we do to get involved with advocacy?
Sure. Well, number one, what you guys are doing now, right? You're using creative ways to, you know, gather people together to learn about issues, through podcasting, social media. So that, right, is having a platform and using it to get a message across. The biggest piece is, as professionals, we have an obligation to give back to our profession. It's not a law, right? It's I believe it sincerely, but as a professional, right, you're doing this and taking an oath, right? When you guys graduate, you're going to take the oath of a pharmacist. And part of that is to contribute and advocate for what you do as a pharmacist, but mainly for your patients. And so, in whatever that is, whether it's joining an organization, whether it is, when you're graduated and whatever you're doing with your life, and maybe you're like, I don't really feel like joining, or we would hope that you stay involved in pharmacy organizations, but maybe it's joining wherever you live, right? Some a club or organization that advocates for homeless health, as an example. I think the biggest piece is using what we do and our knowledge to contribute to better public health and patient health. I think we oftentimes get in the weeds of 340B and pricing and PBMs, and that's important, but how is it impacting, again, the people that we serve, if that makes sense, right? And so a lot of it is I will start here, to kind of end with, how to get involved and do it. You don't have to go crazy. You don't have to like be the director of public policy for NJSHP. I mean, that's great if you want to, but it's knowing who your legislators are, right? And that's easily found on, either calling them, emailing them, ideally meeting with them in person, if you're really into a specific topic. And, the biggest piece is also just you got to start somewhere, right? Start at the local level. I know it sounds so cliche, but it's start with where you work, start with your family, and don't be afraid to engage. The biggest thing is, advocacy is about issue education. So what you guys can do is not, keep doing what you're doing, right? And encourage people to participate, even if, again, it's just simple email.
Yeah, I think it also has to do a lot like just like finding like the interest in the topic. And
Hmm.
I think that also plays a role like how we aren't exposed to it at like this point to like the topic.
Right.
So yeah, just like I think first finding the interest and then like finding platforms to talk about it. Like even with my family, like my dad is very like interested in like politics and everything. He literally every time I go home, he asks me about like AI, like that AI
Sure.
question and like how it's gonna impact my future. So definitely starting a conversation at home and then like put through clubs definitely seems like the right path.
Yeah, exactly. I mean, I think it's a good question that your dad has, especially for, having a daughter that he probably wants to see not live at home forever, right?
Yeah.
And become a, professional. And I think a lot of parents are worried about that too right now. And like I said, I I don't think it's going to replace pharmacists, but it will certainly replace the ones who don't know how to use it,
Mhm.
right? And I truly believe that, right? Certain roles are going to change, but it's also going to expand other roles.
Yeah.
For sure. All right. Well, yeah. This has been a very insightful and honestly, this has been my favorite episode so far, and I've been doing this for almost, almost 2 years at this point.
Well,
This has been a very awesome episode. Just listening to all the issues that's going on with pharmacy and kind of learning more about it, just knowing that we're not powerless as students or as pharmacists. There's so much we can do. And so it just thank you so much for this episode. Right.
you're welcome.
So yeah,
I,
so
I
that
had fun
could
too. I did. I really enjoyed talking about this with you guys and getting
nice.
your insight too.
It's awesome. So yeah, that concludes our interview with Dr. Abazia. Hopefully, um, the viewers at home had as much fun as I did listening and talking to Dr. Abazia. Um, and yeah, so thank you so much for taking the time to just chat with us today, Dr. Abazia.
Thank you guys.
Yes, thank you so much. And to our listeners, let us know what else you want to hear on this podcast, and we'll see you next time.